This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us today for our HealthyU webinar series. Today's webinar is Menopause Weighing on You and is sponsored by New York Cancer and Blood Specialists. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes, and your questions will remain anonymous as always. I'd like to introduce you to today's presenter, Barbara Bragleworth. Barbara is a graduate of Queens College, where she earned a Bachelor's of Science in Food and Nutrition and completed her dietetic internship at Stony Brook University, Department of Family Medicine. She's continuing her studies at Stony Brook University, earning a master's degree in nutrition. Barbara's passion for helping people by meeting them where they are, along with her education as a registered dietitian, makes her well suited to be part of such a unique and patient-centered practice at the Bariatric Center of Excellence at Mather Hospital. Helping others find wellness through balanced nutrition, physical fitness, and a healthy lifestyle is central to Barbara's work. I couldn't have said that any better. Everybody, please join me in welcoming Barbara on her presentation today for Is Menopause Weighing on You?
Thanks, Emily, and I'm happy to report that I finished finally my master's degree at Stony Brook University. So I'm officially a graduate student. So welcome everybody, and thank you for joining me for today's seminar, Is Menopause Weighing on You? This is a topic that is currently something that I'm going through, and in my experience, I got very curious about this particular part of my life, and you know what they say, research is me search. So I'm just excited to share everything that I've learned. So I hope that you guys learned something new as well. So I have nothing to disclose. I have no conflicts of interest. And so for today, I'd like to explain the pathophysiology of menopause. I'd also like to explore the connection between menopause and weight gain, and discuss lifestyle changes that promote healthy outcomes using the principles of the Mediterranean diet. So the topic I plan to cover is the role of nutrition to achieve weight management during menopause. So as a dietitian who specializes in weight management, I will be exploring how hormonal changes during menopause can lead to weight gain. And I just want to emphasize that it's important to view weight management as a behavioral change process, not a diet. So there's a lot of definitions on the internet for menopause, and I liked this one in particular because it defines it as a normal, natural event. It's defined as the final menstrual period that's confirmed 1 year of no menstrual bleeding, and it represents the permanent cessation of menses resulting from loss of ovarian follicular function due to aging. So menopause naturally occurs at the average age of 51. It can prematurely occur from a medical intervention like a hysterectomy or chemotherapy, or really any time from impaired ovarian function. So in the United States, approximately 1.3 million women become menopausal each year. And according to the North American Menopause Society, there are 50 million women currently in menopause. About 5% of women experience early menopause between the ages of 40 and 45. So there are a lot of challenges for women in menopause, but with very little understanding of our biology. Our culture doesn't talk frankly about menopause. And as women, we often feel like we should suffer in silence. So it is my hope that we can learn to appreciate and navigate these changes with more ease. Now, some of these symptoms on here, some people experience all of them, some people don't experience many of them, and we all experience them at different levels. So they can range from hot flashes, night sweats, bladder and reproductive changes, insomnia, fatigue, depression, anxiety, irritability, joint pain, and yes, even weight gain. So menopause is all about changing levels of hormones. And hormones are messenger compounds that travel through the bloodstream, and they direct specific tissues to behave in certain ways. The hormone shift that's most associated with menopause is estrogen. So estrogens are a group of hormones. They play an important role in the normal sexual and reproductive development in women. The women's ovaries are responsible for making most of our estrogen hormones, although the adrenal glands and our fat cells also make small amounts of the hormone. Estrogen affects the reproductive tract, the urinary tract, the heart, blood vessels, bones, breast, skin, hair, mucous membranes, pelvic muscles, the brain, and our metabolism. So we're going to explore in more detail in the upcoming slides, but this infographic gives us a broad overview of all of the systems that are affected by estrogen. So we kind of know this, right? Reproduction, primary hormone for development and growth of the vaginal lining, the fallopian tubes, the uterine endometrium, and cervical glands. It's also a key component in ovulation. And then secondary sex characteristics, so the development of our breasts, the changes in our body shape, bone growth, fat deposition. It's what gives us our curvy figures, right? Pregnancy. Helps us to maintain pregnancy and stimulates fetal maturation. So bone health. It promotes the activity of something called osteoblasts, which are cells that produce bone. When estrogen levels drop during menopause, the osteoblasts aren't able to effectively produce bone, and this can lead to osteoporosis, known as brittle bones. It also can affect our blood flow. It affects the vasodilation of our blood vessels, and it improves blood flow through the coronary artery. So vasodilation is the expansion and contraction of our blood vessels. So they're sort of more elastic because of estrogen. And when estrogen levels decline after menopause, women are at a much greater risk of developing heart disease. And it's because of that estrogen protective factor is no longer there. It affects our body temperature. So our internal body temperature is regulated by a part of our brain called the hypothalamus. All right, so all of these systems that I'm talking about have these estrogen receptors on them. And when there's less estrogen, that system is dysregulated, and that could be one cause of the hot flashes that women experience. There's an oncogenic nature. So there's some emerging research that suggests that estrogen activates cancer-causing genes, which increase the risk of breast cancer and endometrial cancer. It also boosts the production of the brain chemical serotonin. Serotonin is a feel-good hormone. It's a mood balancer. So when we have less of it, women can experience things like irritability. They can suffer from depression. They can suffer from anxiety. So these are real things, again, because we're producing less serotonin, because we're producing less estrogen. Our cholesterol levels. So when estrogen levels decline, levels of LDL cholesterol, which is the harmful kind, increase, and levels of HDL, which is the positive kind, decrease. Now, this can lead to the buildup of fat and cholesterol in our arteries that can contribute to a heart attack and stroke. So when I teach about cholesterol in my classes here, I like to think of HDL as like that kind of big, giant globular cells that are going through the body, and the LDL are little sticky ones that stick to the inside of our arteries. So the HDL gobble up the LDL, bring it back to the liver, and then we get rid of it. So if we have less HDL and more LDL, that could lead to that buildup. And then our bladder, right? Estrogen receptors there too. So reduced levels of estrogen can cause the pelvic muscles to weaken, which is a process known as pelvic relaxation. And as a result, women are at an increased risk for urinary incontinence or the involuntary leakage of urine. Now, metabolism. So declining estrogen levels can contribute to excess body fat. So the way I like to think of it is, because estrogen's role in the female body is so important for many functions, the body wants to hold on to it. Estrogen likes to sequester, or it likes to, sequester itself in fat cells, particularly around the belly area. Now, belly fat can produce substances that cause inflammation that can contribute to the breakdown of muscle. So we're going to talk a little bit more about this, but this can contribute to a decline in our metabolism. So that belly fat is also known as visceral fat. And what happens is, because muscle protein degradation systems, they're modulated by signaling pathways that are activated or suppressed by hormones and cytokines, which are inflammatory cells. So again, the belly fat produces inflammation. Inflammation breaks down muscle. Muscles are a calorie burning engine. So if we have less muscle, it can cause our metabolism to dip. And what is our metabolism? So our metabolism, it's the calories the body burns to sustain the internal work of keeping us alive, our heartbeat, our digestion, breathing. It represents about 60 to 70% of our daily calorie use. Our other calorie use is used for our activities of daily living and in any physical activity or exercise that we do. It's also influenced by things like our age, our gender, our hormones, our muscle mass, and our genetics. So the loss of muscle mass, what I said before about our muscles are our calorie burning engines, and we begin losing muscle mass around 30 years old at a rate of about 15% per year. Now, of course, this is, changes or varies depending on somebody's gender. Like I said before, men are going to lose less of it because they have more testosterone, so they hold on to more muscle mass than we do. There are things that we can do that I'm going to talk about in a little while, so it's not all bad news. And like I said, muscle burns more calories than fat, so we want to hold on to it, because if our metabolism is slower, it's going to make us gain weight faster or easier. So in terms of weight gain during menopause, research suggests that on average, women tend to gain about 1.5 pounds per year in their 40s and 50s. Stress can be a major contributor, and factors can include age-related health problems, aging parents and their needs, empty nest syndrome, or adult children who return home or never left, financial fears around retirement, or divorce. Now, stress eating. So I don't know if Emily mentioned it in the intro, but I actually teach classes here at Mather in our medical weight management program, and I also support our bariatric patients. And stress eating is probably the number one factor, especially in my female patients that are over 40, who report over consuming food in response as a comfort in response to stressful situations or negative emotions. And in my experience, what I find is women have gone their whole lives putting everybody else first, right? Then they get to their 40s and 50s, and now they're taking care of their aging parents. It's a very, very challenging time of life. And so we turn to things that are going to comfort us, and often those things are hyper palatable and hypercaloric. Ultra processed foods, right? Because those are the foods that hijack our taste buds. Those are the foods that make us want to go back for more. They're literally engineered by food manufacturers to make us want to go back for more, and we do. Now, On average, people overconsume 500 to 1,000 calories a day if they're over consuming these ultra processed foods. And just to compare and contrast, to give you a sense of what that looks like, if we were to take an ultra processed food, in my mind, I think of a big piece of chocolate cake, right? That would be the equivalent of, say, 500 calories. Now let's take the equivalent of a nutrient dense food, right? 4 apples, maybe. Who could eat 4 apples in a sitting? We really can't. We weren't really meant to. But those hyperpalatable foods don't keep us full long because they don't have the same amount of fiber that the apples have. They don't have the same bulk that the apples have. So we can overconsume them a lot easier. So, so stress eating, just in summary, can lead to those hyperpalatable foods, which can very easily lead to weight gain. Other factors that lead to weight gain in midlife, some people find themselves in a stride. They're dining out more often. They may be consuming more alcohol more frequently because the kids are grown. They may engage in less physical activity. Some people, they over restrict early in the day, right? They want to conserve their calories, but now they've just set themselves up to be over hungry later in the day. Some people avoid fruits and vegetables and whole grains. That can lead to overconsumption of hyper-processed foods that are calorie dense. And sedentary lifestyle. So modern life makes it too easy to sit too often. And this lack of energy expenditure coupled with an overconsumption of hypercaloric foods can also lead to weight gain. So what do we do about it? Well, first and foremost, we want to think health, not pounds, right? Diet plans that over-restrict eating, that eliminate entire food groups, that promise rapid weight loss over a short period of time, or sell packaged foods, they're not sustainable over the long term. And it could lead to negative dieting self-talk, like if I behave, I'll lose weight, or this food is good, this food is bad. There's no moral judgment about food or the person consuming it. So in our practice here, we really reject diet culture, right? So what is diet culture? Diet culture equates thinness with health. And I don't know about you guys, but if you've ever seen anybody with cancer cachexia or cardiac cachexia, that is where somebody is so sick, their body's in this hypermetabolic state, and they're so thin because they can't keep enough calories in to keep the weight on. That's not thin. Or, other people that just, they may have a fast metabolism, and so they overconsume hyperpalatable foods, but they don't gain weight. That still doesn't mean they're healthy, right? Diet culture shames us into believing that we're somehow broken if we're in a bigger body. Diet culture leads to disordered eating. It could begin as early as 10 years old. It can promote the consumption of harmful substances, over-the-counter weight loss pills, laxatives, colonics, anything to lose weight. And it promotes fad diets, which are often too restrictive to follow for the long term, and it doesn't provide sustainable lifestyle habits. Now, having said that, I am a dietitian that works in weight management, right? So eating mindfully to naturally regulate weight, which may include weight loss, is different from diet culture. And I think it's important to acknowledge and validate that weight loss that naturally occurs by incorporating strategies like portion control, swapping out hypercaloric, ultra-processed foods with nutrient-dense foods, and moving our bodies more is in fact very healthy. I think, just to go back for a second, there's a bit of an overcorrection that's happening right now, especially among dietitians. I see where people are really embracing this philosophy called health at every size. Now, I support that, right? Because we weren't all meant to be in the same body. If God wanted us all to be the same, he'd put braces on all our legs, like Forrest Gump's mother said. So I don't think we should all be the same, but I think the overcorrection is that there's a promotion now almost on consuming all those hyperpalatable, hypercaloric foods because they don't want to shame people. And I don't want to shame anybody either, but I would be remiss as a dietitian if I promoted that and I also, it doesn't align with my values in terms of what health actually looks like. So, habits of successful weight loss maintainers. The National Weight Control Registry was an organization that was founded in 1994 to help identify large samples of people. It's currently at 10,000 who have lost significant amounts of weight and who kept it off for long periods of time. So it's correlational data. What they do is they look at surveys and questionnaires on an annual basis. They follow these people. They see what behaviors they're doing that correlates to them sustaining their weight loss long term. 98% of them reported modifying their food intake. 94% increased their physical activity. The three most common weight loss techniques were limiting the intake of sweets and high-fat items, decreasing the portion sizes of foods, and tracking their food intake. So 60% report tracking. They also limit watching TV. So 62% of them report watching less than 10 hours per week. 78% of them report eating breakfast daily. And successful maintainers report adopting strategies to deal with emotional eating instead of food. So maybe things like exercise or meditation or cognitive behavioral therapy. So, like I said earlier, menopause is relatively new to me. And so when I started to experience these changes, including weight gain, I really threw myself into like researching where can I get evidence-based information. And this book was recommended to me, so I wanted to share it with you. And the next part of the presentation is based on the recommendations that were made in this book. So it's a book that was written by two registered dietitians, Hillary Wright and Elizabeth Ward. And they emphasize it's not a diet. It emphasizes balanced meals and incorporates the principles of the Mediterranean meal pattern, which we do here in our medical weight management program and also with our bariatric patients. We're going to talk a little bit about that. It emphasizes protein, it curtails carbohydrates, it promotes eating regularly, it encourages variety, it's a little bit lower in sodium, and it includes healthy fats. So the Mediterranean meal pattern, something I'm very, very passionate about. It's been studied for over 50 years. And what they did was they looked at people that lived in countries along the Mediterranean Sea. And what they found was, again, correlational data. People that lived in those areas had these benefits: improved brain function, better eye health, lower risk of certain cancers, lower risk of heart disease, lower risk of diabetes, lower levels of blood pressure, lower levels of LDL cholesterol, improved rheumatoid arthritis, reduced oxidative stress, and reduced inflammation. So oxidative stress and inflammation are really the cornerstones to all of that, right? So the better eye health, probably because they're eating lots of fruits and vegetables, which are high in vitamin A and beta carotene, right? Which is good for our eyes. Improved brain function. I don't know if you guys have heard about the MIND diet, but it takes the principles of the Mediterranean diet and the principles of the DASH diet, the dietary approaches to stop hypertension, just by the American Heart Association, and combines the two. So it basically says, eat, let's see, 2 servings of fruit and 4 to 6 servings of vegetables a day. And when the MIND diet just focuses on foods that are really high in antioxidants, like your blueberries and green leafy vegetables and things like that. So that's how it can improve. Oh, go back. That's how it can improve the brain function. Certain cancers, well, cruciferous vegetables like our broccoli, our cauliflower, our kale, our asparagus, all those things can turn on and off cancer genes, lowers the risk of heart disease, again, probably because it's high in fiber. Just interesting side note, because February is Heart Health Month. I don't know if anybody knows Dr. Dean Ornish, if you could Google his TED Talks, but he was the one that really pioneered the research behind plant-based diets and vegan diets to actually reverse heart disease. And part of that is because on the lining of our arteries, we have these cells called epithelial cells. Well, what they found is that as we age, they get kind of like brittle, and so plaque can stick to it. Well, one of the things that smooths them out are diets that are high in fruits and vegetables. Of course, lower the risk of diabetes. They're not eating as many processed foods and sugar as we do. Improved rheumatoid arthritis, that's because of the inflammation. And that's all because of all those fruits and vegetables and omega-3 fatty acids. Okay, now you can move on. So it does emphasize protein. Research suggests that midlife and menopausal women need more protein than current recommended amounts. It promotes satiety. It really just helps us keep feeling fuller longer. It also preserves that lean muscle mass, right? So if we start building doing resistance or strength training, that protein is going to help rebuild that. It can support our bone health. So we want to aim for, probably about 21 grams a meal, which is roughly 3 ounces of any kind of animal protein. It curtails carbohydrates. So notice it's not a low carb diet, but it does recommend consuming less than the standard American diet, which, by the way, the acronym is SAD. It focuses on complex carbohydrates, not refined. So that means whole foods, whole grains, not white rice, not white pasta, things like that. It reduces the portion sizes of starches. Starches aren't bad. We need to have grains in our diet. Very, very healthy for us. We need our legumes. We want our beans. All of those things are very nutrient dense. Problem is, it's a lot of calories for a really small amount. So when we start talking about the portion sizes in a couple of slides forward, we're going to see that a portion size of pasta is about half a cup. So we got to figure out how to volumize that. It also can reduce our risk for type 2 diabetes because it's not promoting the uptake of any refined starches and carbohydrates. Promotes eating regularly, right? So if you're conserving your calories earlier in the day, it can lead to overeating at night. It also better aligns with our natural circadian rhythms that regulate metabolism. So if you think about how we evolved as a species, we didn't have lights, for hundreds of thousands of years, and it was dangerous to go out and forage at night. So really, it kind of makes logical sense not to overeat at night or to eat at night, because those calories are gonna get stored a lot more efficiently. It also may consider consuming higher calorie meals earlier in the day and having smaller meals at night. So there was one study that looked at consuming like 700 calories for breakfast, 400 calories for lunch, and 200 calories for dinner. They took 2 groups who ate the same amount of calories, but the group that reversed that didn't lose as much weight as the group that ate the bulk of their calories earlier in the day, which makes sense because we're moving more earlier in the day. It encourages variety. Balanced eating plans that favor plant foods result in a greater diversity of our beneficial gut bacteria. And that supports our health, our immune system. It supplies the vitamins and minerals and antioxidants we need. So you want to, again, we're looking at adding things, not taking things away. Whole grains, fruits, vegetables, nuts, seeds, beans, lentils. And it could be any whole grain. I'm a dietitian. I don't like quinoa, but I do like brown rice. That's okay. Find something that you like that you can stick with. It's also lower in sodium, which, of course, if you're not consuming hyper-processed foods, you're going for minimally processed foods they're naturally going to be lower in sodium, which is good for our blood pressure. It reduces water retention, and it also helps to manage kidney or liver conditions. It includes healthy fats. So monounsaturated fats, polyunsaturated fats, they're just types of fat. They're not saturated. A saturated fat is like butter or coconut oil. It's solid at room temperature. Monounsaturated fats and polyunsaturated fats are going to be liquid at room temperature. Monos have been found to lower our total cholesterol and the LDL, and the sources are things like olive oil, nuts, and seeds. Polyunsaturated fats, that's our omega-3 fatty acids, right? Those are the ones that are really going to help decrease inflammation. They also decrease triglycerides, which are our dietary fats. reduces blood clotting, and decreases the risk of stroke and heart failure. And the sources are fatty fish, our mackerel, herring, sardines, tuna, salmon, and lake trout. All those guys are rich in omega-3 fatty acids. There are vegetarian forms of omega-3 fatty acids. They're just not converted as efficiently to the EPA and DHA that we're looking for. That's what activates at the cellular level. That's what helps to conquer that inflammation. Hydration. So this is tricky, right? General rule of thumb, we usually tell our patients to aim for 64 ounces because it's an easy thing to remember, 8-ounce glasses a day. Water is very, very important for many functions, as you can see. It helps us to burn fat. Without water, the body can't properly metabolize stored fats or carbohydrates. This process is called lipolysis, and the first step is hydrolysis, which is breaking down the fat into our triglycerides. Drinking enough water is essential for burning off the fat from the food and drink, as well as our stored fat. It helps to increase our calorie burning. It may temporarily increase the body's resting and energy expenditure with the number of calories we burn when resting. It can be a natural appetite suppressant. Sometimes we mistake hunger for thirst. It also can, fill us up a little bit, give us a little bulk. It can help us to remove waste from the body if we struggle with things like constipation. It also helps us with our workouts, right? It's going to transport oxygen to all of the muscles that we're working and our connective tissues and our joints. It helps our lungs and our heart and our other organs to work effectively. It's super important. However, having said that, I now know from my own personal experience that because of those estrogen receptors that are on my bladder, I can't go quite as long as I used to. I tell my girlfriends I'm one errand in and then I'm back at the house again, right? So we still need to consume our water. We just may need to be more strategic about it. Before I became a dietitian, I was in outside sales. And so I knew where all the clean bathrooms were. And as much as I hate to tell my patients to go into McDonald's, they were pretty reliable at having clean bathrooms no matter where I was. So we just have to get strategic about it. The idea, we don't want to set ourselves up for dehydration. Oh, okay. So how do we put it into practice? Rule of thumb, keep it simple. Try to include a fruit or a vegetable at every meal or snack. Eat dark leafy greens regularly. Include a whole grain at least once a day. Eat fish twice a week. Include a serving of nuts or seeds as a meal or snack every day. And use olive oil most often. So there's a podcast that I've been listening to. One of my favorite dietitians, her name is Ellie Krieger. I forget the name of her podcast because it's new, but anyway, she's a registered dietitian. She writes for the Washington Post, and she did a segment recently where her tagline was "Keep ambition out of the kitchen," and I absolutely loved it. And what she did in that podcast was she was interviewing another dietitian, and they shared all of their hacks. And she said, I use Rayo's tomato sauce. I don't make everything from scratch. So people think that as dietitians we tend to be perfectionistic, but I don't make curry from scratch. I find one that's pre-made. I add tons of vegetables to it. So find things that you like that's going to make this process easy. Things like pre-cut, frozen, or even canned vegetables. Just get the ones that are lower in sodium. Fruits, again, pre-cut, frozen, or canned are just fine. Lean meats and seafood, frozen, canned, or refrigerated. I don't know if you guys know this, but seafood is actually fresher frozen because they freeze it right on the boat now. Beans, canned or bagged. I use canned beans all the time. I don't think I've ever made beans from scratch. Nuts and seeds, whole grains, whatever your favorite is. Garlic, eggs, milk, or whatever your milk alternative. I will take a second here to talk about calcium, because we are concerned about our bones. We typically don't take in enough calcium in our diet. And I think that dairy products get a very bad rap these days. They do not cause inflammation, and they're a very, very efficient way to get our calcium. So if you are using a milk alternative, it's also a good source of protein, by the way. So look at the protein and look at the amount of calcium and vitamin D. It should be fortified with those things. Make sure it meets the same criteria as milk. So I'm not going to, talk a lot about this, but this is just an idea of what you want to keep on hand in your pantry. So I talked a little bit about portion sizes. Portion sizes have grown exponentially. Our plates, the size of our plates have grown exponentially over the decades. So we want to get back to what the recommendations are. So believe it or not, a serving of grain would be 1 slice of bread, not 2. A half a cup of rice, a half a cup of pasta. I know that sounds crazy, and that's cooked. Half a cup of cooked oatmeal. We want to figure out ways to volumize that. So one of the hacks that I do, for instance, with pasta is I may use a whole wheat or a lentil pasta, but then I'll add in whatever my favorite zoodles are, right? Whether it's zucchini noodles or butternut squash noodles. I mean, there's tons of spiralized vegetables out there. So I still get that same sensation of twirling it on my fork. I'm still getting a little bit of the pasta, but I'm not over consuming. Or you can just add in whatever your favorite vegetables are. In terms of fruits, you're looking at 1 medium piece of fruit would be the equivalent of 1 cup of fresh fruit or a cup of 100% fruit juice. Again, don't recommend the fruit juice because it doesn't have the fiber in there, and fiber is very important. As a matter of fact, in our medical weight management program, we do an entire class on fiber and probiotics. We also do an entire class on the principles of the Mediterranean diet. Vegetables, you're looking at a cup of raw or half a cup of cooked. So, that DASH diet kind of sounds daunting when you first hear it. You're like, oh my gosh, 6 servings of vegetables. How am I going to do that? But when you think about a serving of vegetables is just a half a cup of cooked. If you do a whole cup of vegetables, that's 2 servings right there. And then 1 cup of vegetable juice, just be careful of the sodium, or 2 cups of leafy green vegetables. And then protein, these are equivalent. So 1 ounce of lean meat, poultry, or fish, you want to aim for 3 ounces at a meal. That's your 21 grams. That's going to promote satiety. And then dairy, a cup of milk or yogurt, or 1.5 ounces of natural cheese. Okay, we can't get away with not talking about physical activity. So in terms of recommendation for the American College of Sports Medicine, the American Heart Association, they recommend 150 minutes of moderate physical activity per week or 75 minutes of vigorous activity. That sounds daunting. If somebody told me that before I started a physical activity program, I would have thought they were crazy. So let's kind of break down what moderate versus vigorous is, and then we can talk about how to apply it. So moderate is that's a brisk walk. You can carry on a conversation, you can't sing, maybe you develop a light sweat after 10 minutes. Vigorous is kind of like a spin class, right? The breathing is deep. You can't say more than a few words without pausing. You develop a sweat after only a few minutes. Feels like jogging. Moderate physical activity, so that brisk walk, is safe for most people. However, if you have or have symptoms of heart disease, kidney disease, or diabetes, or you don't normally exercise, you want to get clearance from your doctor. You also want to use caution if you have high blood pressure, asthma, or any physical condition that may be aggravated by exercise. So before I jump into the benefits, I want to talk about what I was saying before about that 150 minutes or 75 minutes sounding daunting. It can be broken down into segments throughout the day. It doesn't have to be full 30 minutes all at once. And there's lots of ways to incorporate physical activity into just your daily activities. But in terms of benefits, this is something I usually spend a lot of time on in my classes, but I'm just going to briefly go over it. Of course, it's got cardiovascular benefits. If we're doing our cardio, meaning any kind of aerobic, that's going to reduce our blood pressure, improve our circulation, improve the efficiency of the heart and lungs, reduces cholesterol. In terms of glycemic index, It does improve our blood sugar response, and it also enhances our glucose uptake. There are insulin receptors on the outside of our cells. Sometimes in people that have type 2 diabetes or insulin resistance, they don't have as many of those receptors. Weight training and strength training increases the amount of those receptors on the outside of the cell. So it increases that glucose uptake. Of course, it's going to increase our metabolic rate because we're going to be building our muscles, which we know is going to increase our metabolic rate, promotes fat burning if we're doing cardio. And then psychological benefits, it does improve self-esteem. It does reduce stress, anxiety, and depression. Lots of research around that. And then from a physiological standpoint, just as think about the fact that as we're in menopause, we're getting older. So the way I kind of look at things now is I want to be strong and healthy into my 80s. I want to live an independent life. So physiological benefits, it's going to increase my strength, my joint stability, my flexibility, my muscle mass, which are all going to help me age gracefully. So it's frequently divided into two categories that I touched on: our aerobic, which is cardiovascular, and then our strength training, which can be anything from weightlifting with free weights or machines or using body weight or even resistance bands. So aim to include all of these. You want to include, at least cardio. This says an elevated rate for 30 minutes, but like I said, the new science is you can do bouts of 10 minutes. Sometimes I tell my patients, you have to start from where you are. I tell some of my patients, track your steps and add 250 to that for the next week. We're going to be doing this for the rest of our lives. We're not in a hurry. We don't want to jump into something that's going to injure ourselves, right? Or if you work at a sedentary job, set a timer and get up every hour and walk around the office for 3 minutes. Lots of ways you can incorporate that. Muscle strength, aiming for 2 to 3, probably 3 as we get older, realistically, of non-consecutive days of resistance training, and flexibility. So we have to include that light stretching. Even if you go for a walk, the stretching is going to help to prevent injuries. So in summary, this is not your mother's menopause. Knowledge is power. So now that you know why these changes are happening, maybe you can set up some strategies that work in your own life. And practice acceptance. Some weight gain may be an inevitable part of our aging process, but know that we're in control of our behaviors. And last, the sum of our life is not defined by whether or not we can fit into our skinny jeans or not. We're so much more than that. So if I've piqued your curiosity, I want to share with you some information that I found. And by the way, so this North American Menopause Society, I'd been asking all of my practitioners if they could direct me to a gynecologist that specialized in menopause. Nobody could point me to anybody. I discovered this North American Menopause Society website, found a practitioner, and I saw her yesterday. I hope she doesn't mind me saying her name. Her name is Deborah Davenport, and she was phenomenal. It was everything that I wanted. I really felt seen and heard. I strongly recommend the Menopause Diet Plan by Hillary Wright and Elizabeth Ward. And something else that I discovered quite by accident is this YouTube phenomenon, PJ Wren. So her YouTube channel is Fitness with PJ. She has online workouts. She's a certified personal trainer, weight trainer, third age. So she specializes in seniors fitness. She's been a fitness instructor since 1995. And what I really, really like about her workouts is, first of all, she only really speaks to women that are 40 and older. She's 50 herself. And she focuses on osteoporosis. She focuses on our balance. She focuses on building our strength. And, even though she has some, she does say things like, oh, let's get our triceps of our 20s. It's really more about going into this next phase of our life strong and healthy. And last, I'd be remiss if I didn't mention our medical weight management program here at Mather. All right, Emily, let's open it up to questions.
Great, Barbara. Thank you so much. So much information in this
It was too much, and I
presentation.
apologize.
No, it was great. You know what? I'm sure you probably could have talked for a couple more hours about it too. Am I wrong?
Yes, no, you're not wrong.
All right, great. So let's see. If you guys have any questions, please feel free to enter them into the Q&A spot at the bottom of the screen. We have one that says, where can we find the book that you talked about?
Amazon.
Perfect.
And I got it on Audible too. Like I bought the book and I bought it on Audible, so I listened to it.
Oh, great. I'll give it a couple of seconds. What would make an appointment with you? What would that process look like?
Well, the screen that you're looking at, the 631-686-2513, that's our medical weight management program.
Okay, great. And they would just make an appointment with you, and is it covered by insurance? What is the out-of-pocket typically like?
Oh, great questions. So the program is $220 out of pocket. It includes an initial consultation with either myself or Daphne. We're the registered dietitians that run the program, and a series of 10 classes. And then we do a metabolic analysis at the end where we find out exactly how many calories you're burning at rest. And then the meetings with the doctors are covered by insurance, depending on what your insurance is, and we clear that before you come in.
Great. Do you want to talk a little bit about that, finding that happy medium in your caloric intake in a day? Because a lot of times you almost hear of people not eating enough and they're stuck not being able to lose weight or gain weight just because they're in that super low caloric.
Yeah. So you don't ever really want to dip below 1,200 calories. That's not healthy. And if you are, you should be in a supervised program. And this is different from people that have had bariatric surgery. Bariatric surgery is a metabolic surgery. Their metabolisms are different. So I just want to compare and contrast that. But for the general public, you're not going to meet your nutrient needs, right? And as we go into this next phase of our lives and we want to promote our health, eating foods that are nutrient dense and getting one of the slides that I didn't really get to talk about are the nutrients that we need more of as we go into. I talked a little bit about calcium, but there are vitamins and minerals that we need to support our body's processes. I remember my biochem class, my professor said, when you're 20 nothing, you could get away with eating McDonald's every day, and your body is going to regenerate the cells that it can. But if you think, most of us who are on here, I think, know what a cassette tape is. Maybe you don't, Emily. But if you think about that album that you recorded onto a cassette tape and then you shared it with somebody and then they re-recorded that cassette tape and then they re-recorded that cassette tape, well, by the time it got to the fourth or fifth version, it wasn't really good quality anymore. That's kind of what our bodies are like, right? Where our cells are constantly overturning. We need to give ourselves the nutrients that they need to adequately perform and die off, like they're supposed to, so they don't turn into cancer cells. So if you dip below that number, you're not meeting your nutrient needs. So there are predictive equations that us as dietitians can use to individualize. We call that medical nutrition therapy, when we sit down with someone and assess exactly how many calories they're burning based on their physical activity level, their age, their height, their weight. We take all of those things into consideration, and then we can give them guidelines. But at the end of the day, we don't want to get so stuck on the calories that we, again, restrict ourselves from getting certain nutrients we need. Was that too long of an answer?
Oh, that was perfect. And I don't know, I know we don't have a ton of time, but we've got a couple of minutes if you wanted to discuss some of those supplements and nutrients you think are super important.
Yeah, like I know for myself, I also have a history of breast cancer. So hormone replacement therapy is not an option for me. And I have to be really careful about supplements. And like when I was talking about some of those side effects, one of the ones that I personally was experiencing and is insomnia. And so I was really looking, like I am a person that does every single thing that was in those slides. I do get my 75 minutes of physical activity. I do go for a walk every single day. I do everything I can to exhaust myself, and yet I still find myself trouble sleeping at night. So I was looking at certain supplements. Now, if I look at a supplement, I know to go to consumerlab.com. I know it's a third-party review. They're going to tell me exactly what's in that supplement, and whether or not it's effective or not. And one of the things I found in some of the supplements I was looking at, like valerian or ashwagandha, they work with, I guess, promoting estrogen in the body. So it's something that if you have a history of breast cancer, you really want to be careful of that. So I would vet any supplements either through consumerlab.com or find a registered dietitian.
Perfect. Is there a vitamin or a supplement that you know of that might help with hot flashes?
See, that's where I would, my answer is going to be no. I haven't researched that yet. But that person, Dr. Davenport, that I saw yesterday, was pointing me back to that Menopause Society website, because she said that that they have videos and where they even interview professionals that talk about these things. But she said there's a lot of information about hot flashes. Water is a great temperature regulator. So if you are in a position where you can drink water, I always have ice cold water at my fingertips. So if it starts to happen, number one, cognitive behavioral therapy is very effective for hot flashes. So like just accepting that it's happening and knowing that it's going to pass, and what we tell ourselves in that moment instead of feeling panicked. And the other thing is having water close by.
Okay, great. So I put the screen back up just in case anybody
Thank
wants
you.
to take in any of these resources before we hop off. You guys will all be getting a link to complete a survey just so we can learn more about what you'd like to learn in the future and feedback on this webinar so we can report that back to Barbara. Barbara, thank you so much for taking time to be with us today. That presentation was fantastic. And I hope everybody enjoys the rest of their day.
Thank you. Thank you, guys. Have a great day.